Welcome back to my channel. And if you are new to this space, you are also highly welcome. In this lecture, we'll be looking at the clavicle using this image by the side. This is where we have the clavicle highlighted in red. The clavicle is horizontally placed bone around the upper part of the trunk. In this lecture, we'll be looking at the different sub-regions of the clavicle, highlighting the muscles that are related to these sub-regions, and also some important details that you should know as students of anatomy. We said that the clavicle is what is highlighted here in red, and it is a paired collarbone that aligns with the neckline of the shirt. And this is why it is so referred to as the collarbone. It can also be referred to as the beauty bone because of the placement around the upper part or upper region of the chest. So this is where it signifies beauty. It is an horizontally placed bone that is head-shaped in configuration. If you look at this image by the side in anatomical position, this is the alignment of the clavicle. It is seen to be placed horizontally around the upper region of the trunk. If you look at this image by the lower side, you see that it takes an X-shaped configuration that is doubly curved. The clavicle is a subcutaneous bone, and this is why it is palpable around the neckline region. It is structurally seen to connect the sternum with the scapula. If we go back to this upper image, this is where we have the sternum. Specifically, this is the manubrium of the sternum. This is what is harrowed here in blue. You see that the clavicle at its medial end is seen to be connected to the manubrium of the sternum. Bilaterally here, we have the acromion of the scapula. This is the scapula where this arrow is pointing. And this region that is harrowed in blue is the acromion process of the scapula. We also tried to highlight this in our previous lecture on the scapula. We said that the acromion is a lateral extension of the spine of the scapula. So if you go to the posterior region of the scapula, you have a spine that divides the posterior surface of the scapula into the supraspinous fossa and also the infraspinous fossa. It is this spine that further becomes elongated and expanded at the lateral region to become the acromion. It is this acromion that finally creates the connection site for the clavicle at this lateral region. So let's drive further in highlighting some other details about the clavicle. So here we'll be highlighting the articulations and also joints created by the clavicle. We have the sternoclavicular joint, and using this image by the side, this is where we have the sternoclavicular joint. We say that most times all we need to do is to always break down the name. Sternoclavicular, it means a joint that connects the sternum with the clavicle. And this joint specifically connects the manubrium of the sternum with the medial end of the clavicle. This is where we have the manubrium here, harrowed in black. We know that the manubrium is the upper region of the sternum. So it is this manubrium that creates the attachment site for the medial head of the clavicle. And this is where they form the sternoclavicular joint. We also have the acromioclavicular joint. This acromioclavicular joint, all we still need to do is to break down the name acromion and also clavicular, which means that it connects the acromion of the scapula with the lateral end of the clavicle. And this is what is harrowed here in green. And this joint connects the acromion, as we've said, with the scapula. At this posterior region here is where we have the scapula. This scapula is seen to have an acromion process. And this is where this arrow is pointing. This acromion process is what then creates the connection site with the lateral end of the clavicle. And at this point is where they form the acromioclavicular joint. So now let's drive through the functions of the clavicle. The clavicle is seen to connect with the scapula, and this is where these two bones form the shoulder girdle. If you look at this image by the side, this is where we have the clavicle here highlighted in red. And at this region that is harrowed in black is where we have the scapula. These two structures will form the shoulder girdle. And on the scapula, we have a process that is referred to as the acromion. We've tried to highlight this in our previous slide. It is this acromion that creates the connection points to the lateral end of the clavicle. And this is where they create the acromioclavicular joint. If we also go further on the lateral region of the scapula, we have an indentation that is created, and this indentation is referred to as the glenoid fossa. We tried to highlight this in details in our lecture on the scapula. If you've not checked that lecture, or please kindly go and do so. This indentation that is referred to as the glenoid fossa is what receives the head of the humerus, and this is where they then form the glenohumeral joint. This is the head of the humerus here, harrowed and hashed, and this is what fits into the indentation that is created on the lateral region of the scapula. Remember that the scapula with the clavicle form the shoulder girdle. So you see that through the indentation that is created on the lateral border of the scapula, the head of the humerus fits into, the clavicle is also able to connect with the scapula to form the shoulder girdle. So in a way, the clavicle is also contributing to the connection with the upper limb. The clavicle is also seen to allow for the easy swinging of the upper limb, and it does this through the alignment that it creates around the upper region of the trunk. If you look at the placement of the clavicle, we already established in our previous slide that it is an horizontally placed bone. And because of this horizontal alignment, you see that it's able to extend laterally. Because of this extension, at this lateral end, is then able to connect with the scapula. And on the lateral edge of the scapula, we then have the connection of the upper limb. Because of this arrangement that is created around this space, the clavicle is able to allow for easy movement or easy swinging action of the upper limb. And if you look at the alignment created here in dotted blue, you see that the clavicle is able to run an horizontal plane. And this is where it is helping to also push outwards the connection of the upper limb created around the lateral region of the scapula. And because of this arrangement created at this point, is able to allow for free swinging movement of the upper limb so that the trunk does not disrupt the movement or interfere with the movement of the upper limb. It is also seen to transmit shock from the upper limb to the exoskeleton. During impact action, example, during somersaulting, we know that the impact is created more on the upper limb. This impact or shock that is generated around the upper limb is then transmitted to the exoskeleton through the clavicle. And if you look at the pattern that it connects, you will see that the clavicle actually connects with the exoskeleton, and it also connects with the upper limb. Around this lateral region is where we say it connects with the scapula. And the scapula is seen to create a connection with the upper limb. At this medial region, it is seen to be connected to the manubrium of the sternum. And we know that the sternum forms part of the rib cage, which is a structural component of the exoskeleton. We know that the exoskeleton is made up of the skull, the vertebral column, and also the rib cage. So it is through this connection that it creates around its lateral end and also medial end that is able to transmit the weight or shock in the upper limb to the exoskeleton. It's also seen to protect underlying neurovascular structures. If you look at this image of the clavicle, we have a number of vessels here passing below the clavicle. And because of this orientation, the clavicle is seen to be protecting these vessels. And specifically, it is around the medial two-thirds of the clavicle that these vessels run below it. And this is where they are seen to pass through this region, enter into the axilla before they will finally be directed to supply the upper limb region. So fracture of the clavicle that occur around this region will definitely put these vessels at risk. It also creates sites for the attachment of muscles. By the time we dive into this lecture, we'll be highlighting the different specific regions of the clavicle, and we'll also be describing the muscles that are related to them. The clavicle plays a very important role in the abduction of the upper limb. And this is particularly when the upper limb is abducted over the head. There is an abduction process whereby the upper limb is taken away from the body. And when this abduction occurs over the head region, the clavicle plays a very important role in this action. There is a little rotatory action that is exhibited by the clavicle. And this action is the basis onto which the clavicle is referred to as a little key. This little rotatory action is very important in the abduction of the upper limb over the head region, where the clavicle is seen to exhibit a little rotatory action so that the hand can be abducted over the head region. So it is important that we also, like this, in case we have during examination, the clavicle can also be referred to as the little key. And this is attributed to the function that it exhibits during the abduction of the upper limb over the head region, where it is seen to exhibit a little rotatory action. So now let's go to the orientation and features of the clavicle. The clavicle, L-shaped bone that take an horizontal alignment. If you look at this image by the side, this is the clavicle here, harrowed in black. And going to this lower image, you see that it has S-shaped configuration, where you have curvatures created along its longitudinal axis. So it is not a straight bone, even though it is a long bone, but it is seen to exact curvatures, which are 2 in number, along the course that it runs. The clavicle is seen to have a medial head. This medial head can also be referred to as a sternal head. If you go back to this upper image, this is where we have the medial head here, harrowed in green. The medial head, just as the name implies, is the hand that is related to the midline plane. And this is why it is the medial hand. And it is the sternal hand because it is through this hand that the clavicle connects with the manubrium of the sternum. And this hand presents distinct features. It is seen to be larger than the lateral head, and it is seen to present a quadrangular configuration. It is also seen to have a facet that helps to connect with the clavicular notch of the manubrium of the sternum. And this is where they create the sternoclavicular joint. Sternum and clavicle. Sternoclavicular joint is a joint that exists between the manubrium of the sternum and also the clavicle. So if you look at this lower image, this is where we have the medial hand or the sternal head. And this is where we have the sternum here highlighted in green, where it is creating a connection with the medial head or the sternal hand of the clavicle. This medial head is related to a muscle. This medial head of the clavicle is related to the sternocleidomastoid muscle. The sternocleidomastoid muscle is what is highlighted here in this upper image. It's one of the infrahyoid muscles, and this muscle is seen to connect the sternum with the hyoid bone. Remember, the hyoid bone is seen at the roof of the neck. So from this upper region, you have it descending down and have some of its fibers inserted on the medial end of the clavicle. So we have some fibers of this muscle also connected to the sternum. So we have this muscle related to the medial head or the sternal end of the clavicle. We also have on the lateral side, we have the acromial end. This is the lateral end here, harrowed in red. Just as the name implies, it is the end that is located laterally. It is also referred to as the acromial end. It is referred to as the acromial end because it is connected to the acromion of the scapula. So this hand is seen to be smaller than what is seen in the medial hand. It is also seen to be flat and also contain a facet that accommodates with the acromion of the scapula. And this is where they create the acromioclavicular joint. We go back to this lower image. This is where we have the lateral end here that is also referred to as the acromial end. This end is seen to be connected to the acromion of the scapula. This is the scapula here highlighted in orange. So you have the acromion process connecting to the lateral head of the clavicle, and this is where they create the acromioclavicular joint. So you see that we have 2 ends. We have the sternal end and we have the acromial end. This sternal end is the medial end, while the acromial end is the lateral end. And in between these 2 ends, we have the shaft or the body. The shaft or the body is seen to be harrowed here in this lower image. It's also important for us to add that there is a nutrient foramen in the shaft of the clavicle. If you try to use this image down here, this is where we have the nutrient foramen here, harrowed at this point. This nutrient foramen creates the accommodation site for the nutrient artery of the clavicle. Now let's continue with the orientation of the clavicle. In our previous slide, we tried to describe the 2 ends of the clavicle and also the central region, which is the shaft. So now let's drive into the shaft region of the clavicle, where we'll be describing the different regions and also the different muscles that are related to it. We say that the shaft is S-shaped in configuration, which means that it is a doubly curved region. This shaft can be divided into the medial 2/3, which is anteriorly convex, and also the lateral 1/3, which is anteriorly concave. We try to use this upper image here, and we try to create this alignment at this point that is demarcated here in dotted black. The medial region here, where this arrow is pointing, is the medial 2/3, of the shaft of the clavicle. And this region is anteriorly convex. If you look at it, you see that it takes a convex orientation around the anterior border. If you go on the lateral region here, where this arrow is pointing, we have the lateral 1/3. And this lateral 1/3, the anterior border or region of this lateral 1/3 is anteriorly concave. So you see that it runs in a concave orientation at the lateral end, while at the medial end, it runs a convex orientation. This is along its anterior border, and it is important that we highlight it, because if you look at it at the posterior border, it will be presenting another form of curvature. So now let's dive into the muscles that are related to the different sub-regions of the clavicle. Here we'll be looking at the muscular relations of the medial 2/3 and the lateral 1/3 of the clavicle. But first, let's dive into the medial 2/3. Remember, we said that the medial 2/3 is located around the region where this arrow is pointing. So if you look at the inferior border of the medial 2/3, we have the costal tuberosity. The costal tuberosity, just from here driving it into the name, costal means ribs. So this tuberosity creates the attachment site for the costoclavicular ligament. Let's try and use this image at this lower side to explain the costal tuberosity. Remember, we said that this tuberosity is located at the inferior border of the clavicle. This border is not seen to be exposed. And this is what is seen to be exposed in this lower image. So if you look at this alignment, you see that this is the inferior border of the clavicle. This is what is exposed here in this lower image. And if you try to create an alignment here along this point, highlighted in dotted black, this is where we have the medial 2/3, and this is where we have the lateral 1/3. So for the medial 2/3 at the inferior border, we have the costal tuberosity. And this is what is harrowed here in purple. This costal tuberosity, we say, creates the attachment site for the costoclavicular ligament. If you try to break down the name costo and clavicular, it means a ligament that connects the rib, which is the costal, to the clavicle. So you see this ligament connecting the first rib to the inferior border of the clavicle. So let's try and use this upper image to describe more to how this ligament runs. Remember, this is the medial 2/3 of the clavicle. So at this inferior border, which is not shown here in this image, you have the costoclavicular ligament running and finally inserted on the first rib. And this is what is highlighted here in black. So you have the costal tuberosity at the inferior border of the medial 2/3 of the clavicle, creating an insertion site or point for the costoclavicular ligament. If you also drive more laterally, still within the medial 2/3 of the clavicle, you have the subclavian groove. This is what is shown here in this image in this lower portion. Remember, we said that this image here is exposing the inferior border of the medial 2/3 of the clavicle. So if you go more laterally from where you have the costal tuberosity, remember this is where we have a costal tuberosity. If you go more laterally to this region, you have a groove that is created for the subclavius muscle. Remember, sub is below, clavicle, which means a muscle that is located below the clavicle. And remember, we said that this is the inferior border or region of the clavicle that is exposed here in this image. If you also go back to this upper image, this is where we have the subclavian groove that is highlighted here in yellow. You see that this groove is located at the lateral region of the costal tuberosity. Remember, this is where we have the costal tuberosity where this arrow is pointing. So if you go more laterally, but still within the medial 2/3 of the clavicle, you have the subclavian groove. So this subclavian groove is what accommodates the subclavius muscle. Then if you go more in the anterior region, the medial 2/3 of the clavicle is related to the pectoralis major muscle. Let's say I use another image of the clavicle that is showing the anterior region of the clavicle. And this is where we use this lower image at this point. Remember, we have an alignment created that is highlighted in dotted black, where we have the medial 2/3 and the lateral 1/3. So this is the anterior border of the clavicle. So in the anterior region, you have the connection of the pectoralis major muscle. And this is what is harrowed here in black. So you have the pectoralis major muscle related to the anterior border of the medial 2/3 of the clavicle. So let's go back to this upper image where we'll be highlighting how the pectoralis major muscle runs, and it is seen to be related to the anterior border of the medial 2/3 of the clavicle. This is where we say we have the medial two-third, and this region that is exposed here in this upper image is the anterior border. So you have the fibers of the pectoralis major muscle running from the anterior border of the medial two-third of the clavicle. And you also see some of the fibers originating from the sternum, finally collected together and inserted on the humerus. This is where we have the humerus. We know that the pectoralis major muscle takes a fan-shaped configuration. This muscle is located in the anterior region of the chest. So you have the clavicular portion of the pectoralis major originating specifically from the anterior border of the medial two-third of the clavicle. So if you go more to the superior region of the medial two-third of the clavicle, you see that it is related to the sternocleidomastoid muscle. If you try to use this lower image, this is where we have the anterior view. So above this space, we have the superior region. And this superior region is what is harrowed here in blue. This region is related to the sternocleidomastoid muscle. If you go back to the sternocleidomastoid muscle, you see that it's a muscle that has 3 points of contact, which include the sternum, the cleido, which is the clavicle, and also the mastoid process of the temporal bone. And this is why it is so named sternocleidomastoid muscle. If you try to use this upper image in describing the orientation of sternocleidomastoid muscle, this is what is highlighted here in blue. You have a limb connected to the sternum, and another limb also connected to the mastoid process of the temporal bone. And finally, you have the third limb connected to the superior border or surface of the medial two-third of the clavicle. And this is what is shown here in this image. So you see that specifically the sternocleidomastoid muscle is related to the upper border of the medial two-third of the clavicle. So we've tried to describe the different sub-regions of the medial two-third of the clavicle, so the muscles that are related to them. So now let's go to the lateral one-third. For the lateral one-third, at the inferior border of the lateral one-third, we have the conoid tubercle. So let's use this middle image here to illustrate this, because this image is what is showing the inferior border of the clavicle. Remember, we already divided the clavicle using this alignment where we have the medial two-third and the lateral one-third. So for the lateral one-third, we have the conoid tubercle here, carried in purple. This conoid tubercle is a tubercle that is created for the conoid ligament. And this is the conoid ligament here highlighted at this point. So if you go more laterally from the conoid tubercle, we have the trapezoid line or the trapezoid ridge. And this is what is harrowed at this other region. So you see that laterally to the conoid tubercle, we have a trapezoid line or ridge around this space. And this space is what creates the attachment site for the trapezoid ligament. The conoid ligament that emerges from the conoid tubercle and also the trapezoid ligament that emerges from the trapezoid line or ridge come together to form the coracoclavicular ligament. Remember, we described this coracoclavicular ligament in our previous lecture on the scapula. We said that this ligament connects the coracoid process of the scapula to the clavicle. And this ligament is structurally made up of the conoid ligament and the trapezoid ligament. So you have the conoid ligament forming the medial portion or region of the coracoclavicular ligament, and we have the trapezoid ligament forming the lateral portion of the coracoclavicular ligament. So you see that these two ridges created at the inferior border of the lateral one-third of the clavicle creates the contact point for the coracoclavicular ligament. And it is important that we highlight that this coracoclavicular ligament is divided into two sub-regions. On the medial side, we have the conoid ligament, while on the lateral side, we have the trapezoid ligament. And it's important that we highlight, in case we are asked during examination, that the coracoid ligament is structurally made up of what? We should know that it's structurally made up of the conoid ligament and the trapezoid ligament. These two ligaments will come together to become the coracoclavicular ligament, which of course connects the coracoid process of the scapula to the clavicle. Let's try and use this upper image to also illustrate how the conoid ligament and the trapezoid ligament emerge. Remember, we already created an alignment here using this dotted black. We say this is the medial two-third and this is the lateral one-third. So for the lateral one-third, around the inferior border, which is not seen here in this image. So below this region where this arrow is pointing, we have the emergence of the conoid ligament, and we also have the emergence of the trapezoid ligament. You see that these two ligaments will come together and finally will be inserted or the coracoid process of the scapula. And this is what is exhibited here in the exhibit. Then if you go more in the anterior region, within the lateral 1/3 of the clavicle, the structure or the muscle that is related to this space is the deltoid muscle. If you try to use this lower image, remember we said that this lower image of the clavicle shows the anterior region of the clavicle. And we already divided it having a medial 2/3 and a lateral 1/3. So on the lateral 1/3 in the anterior region, we have the deltoid muscle, and this is what is harrowed here in black. So it is related here at the anterior region with deltoid muscle. Let's try and use this upper image to describe how the deltoid muscle also runs around this region. So this is where we have the fiber here of the deltoid muscle, and you see it running from the anterior surface of the lateral 1/3 of the clavicle, and you see it creating a curvature or a contour around the shoulder. And then if you go to the posterior surface of the lateral 1/3, you have the trapezius muscle. So if you try to use this lower image also, remember this is the anterior view. So if you go behind at the posterior region, that is harrowed here in blue, you have the trapezius muscle. So this is what is related to this region. And if you also try to use this upper image to explain or describe how the trapezius also run, you see it running from the posterior region of the neck, and finally it is inserted at the posterior surface or region of the lateral 1/3 of the clavicle. If you look at how the trapezius runs, you see that it is around the posterior region of the neck. So you should expect that it will finally be related also to the posterior region of the lateral 1/3 of the clavicle. And this is what is exhibited here in this image. So we've tried to describe the different sub-regions of the shaft, so the different muscles that are also related to the different borders. So now let's look at some fun facts about the clavicle. The clavicle is the first bone to ossify in the body, and it begins to ossify around the 5th to the 6th week of intrauterine life. It is also the last bone to complete ossification, and this is completed at around the 20s. It is also the only long bone that has 2 primary ossification centers. Long bone generally are seen to have primary ossification centers. The primary ossification centers usually 1 in number, but for the clavicle, it has 2 primary ossification centers. The clavicle is also seen to exhibit intramembranous ossification. We know that long bone generally undergo endochondral ossification. Clavicle is different in this regard. Even though it is a long bone, it is seen to undergo intramembranous type of ossification, except at the medial edge, where it is seen to exhibit endochondral ossification. It is also seen to lack a medullary cavity. We know that long bone generally are seen with space, which is referred to as the medullary cavity around the shaft region. This is what creates the accommodation site for the bone marrow. But the clavicle is not seen to have this kind of configuration. It is also the long bone in the body that lies horizontally. If you look at the configuration of long bones, such as the humerus, the tibia, the femur, you see that they run a longitudinal alignment. But the clavicle is different in this regard because it is seen to run in a transverse orientation. The clavicle is also a subcutaneous bone, and this is why it is palpable. And finally, the clavicle has no homologous structure in the lower limb. If you look at the configuration of the lower limb in the pelvic girdle, we do not have a structure that is homologous to the clavicle in that region. So let's look at clinical anatomy. Let's look at fracture of the clavicle. Fracture of the clavicle is common, and it is seen to occur most in the mid to third in about 80% of subjects, while 15% of subjects are seen to have their fracture in the lateral third, while the lowest incidence of clavicular fracture will occur in the medial third. So if you try to use this alignment here, this is where we have the orientation of the clavicle. The medial side, you have the lateral side. And if you try to divide this clavicle into thirds, you have the medial third, you have the middle third, and you have the lateral third. So we say that the highest incidence of clavicular fracture will occur in the middle third, and specifically is at the point or the junction where the medial two-third is transformed into the lateral 1/3. Remember that the clavicle is a doubly curved bone. So at the point where we have this transition is the most common site where this fracture can occur, and it is within the middle third of the clavicle. While we have 15% of these cases occurring in the lateral third and 5% in the medial third. It is also important that we had that during fracture, the medial part of the clavicle is seen to be projected upward. We try to use this radiographic image by the side. This is where we have the medial side. And if you look at the medial component of this fracture, you see that it is directed upward. And this direction is as a pull from the sternocleidomastoid muscle. Remember, we described the sternocleidomastoid muscle that is related to the superior surface or border of the medial two-thirds of the clavicle. And because of this, it is able to pull this region upward. And this is why you have this kind of presentation. And on the lateral side, you see that there's going to be a pull downward. This is the lateral region of the clavicle. So you see that the lateral component will be pulled downward. And this downward pull is as a result of the gravitational force of the deltoid muscle and also the arm. If you look at this region, we have the deltoid muscle. We say that the deltoid muscle is located on the anterior surface of the lateral one-third of the clavicle. And also at this lateral region, we have the upper limb fixing into the glenoid cavity of the scapula. So these two structures, the deltoid muscle and the arm, will be pulling this lateral component of the fracture downwards. And this is why you have this kind of presentation here. So it's important that we're able to explain the basis behind this presentation when fracture occurs. Let's continue to stay glued to my channel.